A pleasant day to you. I am Noriel Castillo, the Clinical Chief Resident of East Avenue Medical Center, Department of Obstetrics and Gynecology. Come join me as you take a tour of Quezon City's leading tertiary referral center. Our outpatient department caters to both obstetric and gynecologic cases. Before the COVID pandemic, about 100 to 120 cases per day were seen at our facility. Currently, these numbers have decreased to an average of 40 to 70 patients per day. Patients are initially assessed at the triage, where they also sign a health declaration form for COVID-19. Suspects are examined at the isolation tent located near the entrance of the OPD by an OB resident. Non-suspects proceed to the third floor OPD. We perform minor procedures such as pap smear, visualization with acetic acid, microscopy, and biopsies. We also cater to patients with birth spacing and contraception concerns. We have a special family planning counseling room just for them. All consultations and minor procedures are logged, including their follow-up schedule. Teleconsults are also held at the outpatient department. A resident is assigned to answer queries and facilitate online consultations. All consults are recorded in a logbook. Before the pandemic, the consultant on duty was required to be physically present in the OPD. Consultants, residents, and students are required to sign the OPD attendance logbook. With the pandemic, referrals were made by phone and an audit is done by the consultant with the OPD team at the end of the day. This is our consultation area in the emergency room. There is a setup for interview and examination. There are 3 examination beds and 1 bed for the CTG. Dopplers, speculum, retractors, and a delivery kit for imminent patients are on hand, as well as emergency medications, an oxygen tank, and supplies for blood extraction and intravenous insertions. We keep our own emergency kit for eclampsia, postpartum hemorrhage, and perimortem cesarean sections. Daily consultations range from 40 to 80 ER consults each day, addressing all patients with non-immediate as well as immediate and complicated obstetric and gynecologic concerns. 2 residents are assigned here, 1 junior and 1 senior resident. All patients seen here are referred to the senior resident for concurrence for final disposition. All admissions are referred to the consultant on duty. There is an available operating room here in the ER, shared by the other specialties. We have used this at times when our ORs are occupied. The East Avenue Medical Center main building was established on October 8, 1969 as the GSIS Hospital and is now under the Department of Health. It has a total of 7 floors, and most of our facilities are located on the 3rd floor. It is connected to the CERID building, where we have our own LRDR OR complex for COVID suspects and confirmed cases. Welcome to the LRDR OR complex. In here, Level 3 PPE is enforced, and donning and doffing areas are specified. This is our labor room, which can accommodate 10 beds. There is a shower area for patients admitted in early labor. Here, 1 resident per year level are assigned. We have 3 cardiotochogram machines, handheld Dopplers, a portable ultrasound, 12 lead ECG machines, and a pipe and oxygen supply in this area. Within the complex, the high-risk unit can accommodate up to 6 beds with cardiotachograms and bedhead panels with oxygen. In here, patients with high-risk pregnancies stay for observation and close monitoring. This is our delivery room. There are 2 delivery tables, and EINC is practiced when feasible. Junior residents are assisted by the senior residents during deliveries and procedures. We have a total of 4 functional operating rooms, 3 for obstetric and gynecologic cases, and 1 for minimally invasive endoscopic procedures. The sets for spontaneous vaginal delivery, forceps delivery, curettage, cesarean section, and major sets for laparotomy, minor sets and retractors are stored and organized in our supply room. When the specimen is out, the OB resident pathology rotator will cut the specimen and submit it for histopathology. There is a dedicated OR for laparoscopy and hysteroscopy. We have one laparoscopy tower and one hysteroscopy tower, which are maintained by the fellows. Level 1, 2, and 3 procedures like total laparoscopic hysterectomy are done here. Our newly renovated neonatal intensive care unit at the 3rd floor can accommodate up to 80 beds and is equipped with incubators, warmers, and bed panels with oxygen. It is manned by the section of neonatology with their consultants, fellows, and nursing staff. We work hand in hand with the neonatology section to improve fetal outcomes and discuss our cases during the perinatology-neonatology conferences. We also have a milk bank and a lactation station for employees. Pre-pandemic, we had 3 available service wards capable of accommodating a total of 157 beds. However, during the pandemic, our wards were reclassified as non-COVID, transition ward for asymptomatic patients waiting swab results, and the COVID ward. We have a lounge for the residents dedicated to provide their basic needs during their tour of duty, water for refreshment, sleeping area, and dining area. Our ultrasound room is located just outside the LRDR OR complex of the 3rd floor. It is manned by the consultant of the day, the fellows in training, and the resident rotators. It is equipped with 3 ultrasound machines with capability for 2D, 3D, and Doppler. It operates daily except on Sundays. Emergency scans are also done upon request. Before the pandemic, 50 patients were seen per day. But since the pandemic, we see approximately 30 patients per day, 10 gyne, and 20 OB cases. Scans for fetal aging, biophysical profile, ectopic pregnancy, abortion, multifetal pregnancies, and congenital anomaly scans are the most frequent procedures. This is our newly renovated department office. We have the chairman's office and the training office. Our important documents stored in this area include the residency training manual, the resident evaluation forms, the clearbooks including the File 101 of residents, the residents' logbooks, annual statistics reports, the researches done by our previous residents, mortality reports, attendance logbooks, and proceedings of the conferences. This is our library located beside the training office. A variety of reference books, clinical practice guidelines, and other resource materials are made available for residents. Other department records like operative records and department statistics are kept here. We purchased several Wi-Fi modems for the residents' use for their reports and researches, as well as an up-to-date subscription. This is our colposcopy room located beside the department office where the residents perform colposcopy under the supervision of our gyne-oncology consultant. It is equipped with speculums, retractors, tenaculum, a colposcope, and biopsy forceps. Cryotherapy can also be performed. This is the Department of Pathology and Laboratories located on the ground floor. This is the range of laboratory services provided. We are always in close coordination with our blood bank staff to provide the necessary blood products to our patients. Blood donation and blood banking are done here. We also have our own COVID-19 RT-PCR molecular laboratory. The hospital staff and our patients can have their swabbing for COVID-19 here free of charge as long as they are PhilHealth members. The Department of Pathology has a certified pathology residency training program. Our pathology rotators are assigned to receive and examine the specimens from our operating room. Then, they are taught how to cut and process specimens for histopath. They join the consultants in the reading and reporting of the slides. They are also assigned to report during our quarterly surgical pathologic conferences. Our radiology department, located on the ground floor, offers X-ray, CT scan, and MRI. A portable chest X-ray machine is also available. Shown here are the 7th floor conference rooms and auditorium. This was where we used to conduct our weekly conferences and meetings. These areas can accommodate all our consultants, residents, fellows, and students. Since the pandemic, our conferences were conducted online using our Zoom subscription, which can accommodate 100 participants. All our Zoom conferences are recorded. This is our COVID facility, which we call the CERID building, which stands for the Center for Emerging and Re-emerging Infectious Diseases. It opened when East Avenue was declared as a COVID center. It was originally designated for outpatient subspecialty services and ambulatory surgery. We have a designated examination area in the ER on the 1st floor. On the 3rd floor of this building is our CERID LRDR/OR complex and COVID ward. Level 4 PPE is enforced here for all healthcare workers. Donning and doffing areas are specified. We hope you enjoyed this tour video. In behalf of the Department of Obstetrics and Gynecology of East Avenue Medical Center, thank you accreditors and see you soon!